Now, in terms of making a diagnosis of IPF, one first has to differentiate it from other forms of ILD. So it is a diagnosis of exclusion. Depicted here is a mnemonic that some folks find helpful. I certainly do in my clinical practice. And this mnemonic is defined by 5 I's and an N. The I's stand for various broad disease categories. And if you remember all these different I's, then you'll cover most causes of interstitial lung disease. So the first one shown here are the idiopathics. And under the idiopathics, we have the idiopathic interstitial pneumonias with multiple different disease conditions constituting the IIPs. IPF being the most common, NSIP being the second most common, together with the unclassifiables. NSIP is nonspecific interstitial pneumonia. And then there's an alphabet soup of other conditions like cryptogenic organizing pneumonia, respiratory bronchiolitis associated interstitial lung disease, desquamative interstitial pneumonia, acute interstitial pneumonia, lymphocytic interstitial pneumonia, and PPFE is pleuroparenchymal fibroelastosis. Under the idiopathics, you also have other conditions such as sarcoidosis, amyloidosis, LAM, and others as shown on this slide. The second I to think of are the immunologic conditions, specifically connective tissue disorders. Things such as rheumatoid arthritis, scleroderma, lupus, mixed connective tissue disease can all result in interstitial lung disease. And not infrequently, the lung disease might be the first harbinger of an underlying connective tissue disorder. Inhalational conditions or inhalational injuries can also result in interstitial lung disease. Think of asbestosis, silicosis, and then also chronic hypersensitivity pneumonitis, which is sometimes very difficult to differentiate from IPF. And the next are the iatrogenics, what we as physicians and providers impose on our patients in terms of medications, certain antiarrhythmics like amiodarone, chemotherapeutic agents, and certainly radiation can all result in fibrosis. The fifth I to complete the story are infections. Certain viral infections, fungal infections like PJP can give you diffuse interstitial infiltrates. The N stands for neoplasms. There's certain somewhat rare neoplasms like lymphocytic carcinomatosis or bronchoalveolar carcinoma that can present with interstitial infiltrates. And sometimes we add a C onto the mnemonic, so 5 I's, a C, and an N for chronic congestive heart failure, although that's usually pretty evident and easily differentiated from interstitial lung disease.